Hello friends! If you suffer from severe repetitive headaches, and especially if your headaches are recalcitrant to medications, acupuncture very well might be the answer. So this video will discuss combination of points that helps to relieve these headaches. And this combination has been around for literally hundreds of years and it still works much better than modern pharmaceuticals. I see in my clinic many patients who have been on medication for many years, and basically what medications do, they treat the symptoms, but they cannot possibly prevent future bouts of these headaches. However, this combination of points not only treats the symptoms, but it also prevents future bouts of the headaches. So it treats also the root of the problem. So let me share this combination with you right away, and if you are a practitioner of acupuncture, you can try it in your clinic, or if you're a patient and your acupuncture physician struggles to help you with the headaches, you can share this protocol with them and they can implement it for you. So here it comes. Do 20, do 21, do 23, small intestine 5, large intestine 4, Sanjiao 1, bladder 60, and gallbladder 41. Now let us discuss the nature of these headaches as we see them in Chinese medicine. The proper name for this type of headache in Chinese medicine is called head wind, and it's a condition that has aspects of both external and internal pathogenic factors. So wind is considered one of the 6 pathogenic qi or energies that can afflict human body. In fact, wind is the most prominent of the 6 pathogenic qi. Its nature is yang, and so it affects upper part of the body, and usually it afflicts superficial aspects of anatomy. And in terms of the 5-element classification, it belongs to the wood phase. Wind enters the meridians on the head and blocks them, and when the qi is blocked, that's when people have headaches. And many people with chronic headaches, they have chronic residual wind in the channels already, and even a small invasion of the pathogenic wind will trigger a cascade of symptoms. So typical symptoms of wind, they come and go or they change. In addition to headaches, other symptoms of wind are tremors, convulsions, itchiness. However, not all symptoms of wind are associated with movement. Clenched jaw and paralysis, facial paralysis, are also considered wind symptoms. And so many people report some of these symptoms alongside with chronic headaches. And many people report that these symptoms flare up with a barometric change. Hence, we say that wind is an external pathogenic factor. However, it also has an internal component. And so yang excess always comes with yin insufficiency. And typically, sufferers of chronic headaches also have liver blood or liver yin insufficiency. Next, let us discuss which channels are implicated in this pattern. Well, the first channel that we need to discuss is the governing vessel. We call the governing vessel the Sea of Yang, and all the Yang channels connect to it. And in case we deal with an excess of Yang condition, such as invasion of wind, it absorbs excess of pathogenic Yang. Of the Yin meridians, the only meridian that travels to the head is foot Jue Yin liver channel. A branch of this channel goes through the forehead and terminates at the point do 20, which is the topmost point of the governing vessel. Of the Yang meridians, all of them travel to the head. However, we are most interested in the foot yang channels because their trajectories traverse the areas which typically manifest as headaches. And when we speak about the arm yang channels, they mostly terminate at the lower part of the head, the face and the neck, and they are responsible for opening to the ears, the nose, and the mouth. However, for the ease of diagnosis, we are going to discuss the symptoms of the long channels. And so, Tai Yang is represented by the bladder and the small intestine meridians. And Tai Yang type of headache typically goes along with stiff neck, occipital, suboccipital headache, vertex headache, or front of the forehead. When we speak about the Shao Yang type of headache, it's a headache in the temporal regions or one-sided headache. Shao Yang is a combination of the foot Shao Yang gallbladder and hand Shao Yang Sanjiao meridians. Yang Ming channel is comprised of hand Yang Ming large intestine and foot Yang Ming stomach channels, and Yang Ming is a frontal headache. When we speak about the liver or foot Jue Yin headache, it's a vertex headache. Amazingly, the combination of points that we're discussing can treat any of these type of headaches. If you're not sure about the energetics of points, we can just needle bilaterally all these points and with great results. However, sometimes when the presentation is more complicated than just a headache, we want to use less needles, and then we want to make sure we understand which side of the body needs to be treated for the best possible results if we want to add some other points. And so let us discuss energetics of individual points. As I've already mentioned, the governing vessel is called the Sea of Yang, and so the very first 3 points in this prescription belong to the governing vessel, Do 20, Do 21, and Do 23. So these points, they drain the Sea of Yang, right? So we want to these points they specifically have function of clearing head wind, and we can needle these points. We can also bleed them, because in Chinese medicine there is a saying that to expel wind you want to move blood. The next point in this prescription is small intestine 5. It's a fire point on the small intestine channel, which also belongs to the fire phase. Small intestine 5 is a true fire point, and as such, great point to drain liver phase. Why? Because fire phase drains is a child phase relative to the wood phase, and when we have excess in the wood phase, we want to drain it. In addition, small intestine 5 is located at the wrist, and so holographically it represents the nape of the neck, and because it's connected to the bladder channel, because it's part of the Tai Yang system, this point is great to treat a headache that also has neck tension as part of the representation. Another holographic correspondence of small intestine 5 is the eye region, and so this point is also great when there is pain around the eye area or the forehead. Next point in our presentation is large intestine 4. It's a source point on the hand Yang Ming large intestine meridian, which responds to the metal phase. And as a source point, this point is going to enhance or strengthen the metal phase. And metal controls wood. It's another element of controlling the excessive wood phase. In addition to that, holographic correspondence of the large intestine 4 point is the face. The next point in our prescription is Sanjiao 1. It's a metal point on the Sanjiao channel. And again, metal phase controls the wood phase, and so all Jingwell points on the Yang meridians, they all correspond to the metal phase, and they all can be used to treat wind. and in particular sign Jie because it's connected to the gallbladder channel as a part of the Shao Yang Meridian. It's a great point to treat temporal headaches. And the next point in our prescription is bladder 60. And this is a very famous point to treat head wind. In fact, this point has been mentioned in the systemic classic of acupuncture and Max Sebastian. It's a 3rd century treatise on acupuncture, and it states that bladder 60 drains wind from the head to the feet. In addition to connecting to the governing vessel at the point Du20, bladder 60 also connects to the gallbladder channel at 3 points: gallbladder 7, gallbladder 12, and gallbladder 15 points. It's a temporal region, and so this point treats not only Tai Yang type of headaches but also Shao Yang. Very powerful point for headaches. This point is located at the ankle joint, and so it has holographic correspondence to the neck region, and so anytime we have neck pain, we should consider this point. And the last point in our prescription is gallbladder 41. It's a shoestring and the wood point on the gallbladder channel. And so gallbladder channel belongs to the wood face, and gallbladder 41 is a wood face point. And so this is a true wood point. We already had the true fire point. Now, true wood point will balance the excess and deficiency within the wood phase. In particular, gallbladder 41 has a profound effect on the eyes. And so anytime there is a headache behind the eyes, we want to use this point. And just like I said, if you are unsure about the presentation, if you are unsure how to use contralateral needling, you can always needle these points on both sides for best results. And you want to retain needles for at least 25 minutes. This is how much time it takes for the qi to circulate through all 12 primary meridians. So this is all for today. If you have any questions or comments, don't hesitate to message me. I've been your host, Andrei Yershov, and I will see you next time.